This unit covers the principles and goals of malaria elimination. By the end of this unit, you should be able to 1. Explain the difference between malaria control, elimination, certification, re-establishment, and eradication. 2. List the malaria elimination milestones and targets of the Global Technical Strategy for Malaria 2016 to 2030 GTS. 3. Explain the concept of the malaria transmission continuum and its relation to elimination. 4. Describe the key principles of malaria elimination. Before we begin discussing the principles and goals of malaria elimination, it is important to have a common understanding of the definition of some important terms related to elimination and eradication. Control refers to the reduction in or maintenance of the burden of malaria to a locally acceptable level where the numbers of cases and deaths are low enough that they no longer constitute a public health problem. Interventions must be continuously applied or there could be a significant resurgence in the numbers of cases and deaths. Recently, the malaria community has also referred to control as burden reduction. Both of these terms mean that malaria transmission continues to occur, but malaria is no longer an important public health problem. Elimination refers to the interruption of local transmission of specific human malaria species in a defined geographical area. Interruption means reduction to an incidence of 0 indigenous cases. Elimination could occur at a subnational level or at a country or regional level. In the distant past, the term eradication was often used where we would now say elimination. Elimination can refer to just one human malaria species or all of them. For example, in the Greater Mekong subregion, there is an immediate goal of eliminating P. falciparum because of concerns over the development of drug resistance, while the goal for eliminating P. vivax is farther away. Although malaria may be eliminated in some geographical areas, it will still occur in many other parts of the world. Therefore, continued prevention of re-establishment of transmission is required. Certification of elimination is the official recognition of a country's elimination of malaria. WHO grants this certification after a careful review of evidence that a country has successfully interrupted transmission and has a program in place to prevent re-establishment. We will cover the criteria and process of certification more thoroughly in Unit 13. Re-establishment of transmission means that an area that was previously malaria-free has renewed malaria transmission. This could happen at any time after elimination of malaria if countries are not careful to assess and manage jointly the risk of transmission in areas with competent and abundant vectors and the risk of importation. At times, people use the term prevention of reintroduction rather than prevention of re-establishment. There are technical differences between these terms, and prevention of re-establishment is the preferred term. We will talk more about re-establishment in Unit 9. Finally, eradication means that all cases of human malaria have been extinguished throughout the world. Once eradication is achieved, no further malaria interventions will be required. To date, the world has only eradicated one human disease, smallpox. While there is no target date set for eradication, a malaria-free world is the vision of WHO and the global malaria community. An older elimination manual included the category of pre-elimination. We no longer talk about pre-elimination because the GTS urges countries to accelerate towards elimination. For many countries to get to elimination, however, They must first control the disease, reducing it to a level that is low enough for intensive and highly targeted interventions to be implemented to eliminate the disease. Before we go any further in understanding malaria elimination, we should all get on the same page with these key definitions. The meanings of these terms, control, elimination, certification, prevention of re-establishment, and eradication, have changed over time and are often confused. Break into small groups of no more than 6 participants and discuss each term, sharing your understanding of the term and whether it differs from the definition provided. What countries do you know that have controlled malaria? Which countries have eliminated malaria? Are there subnational areas that have eliminated malaria? Do you know any areas where transmission was eliminated and then re-established? Now that we understand the differences between control, elimination, and eradication, let's discuss the current goals and strategies to deal with malaria. The world has a plan to tackle malaria and reduce transmission substantially by 2030, the GTS, which was endorsed by every WHO member state at the World Health Assembly in 2015. The updated version of GTS, endorsed by the World Health Assembly in May 2021, reflects lessons learned in the global malaria response over the last 5 years. The vision of the GTS is a world free of malaria. This vision is equivalent to the concept of malaria eradication, which, as we have learned, refers to extinguishing human malaria everywhere in the world. The GTS consists of 3 pillars with 2 supporting elements. Pillar 1. Ensure universal access to malaria prevention, diagnosis, and treatment. The WHO recommended package of core interventions, namely quality-assured vector control, chemoprevention, diagnostic testing and treatment, can dramatically reduce morbidity and mortality. The matrix of success are reductions in malaria case incidence and malaria mortality rates. WHO recommends implementing prevention strategies based on vector control and, in certain settings and in some population groups, administration of chemoprevention and universal diagnosis and prompt effective treatment of malaria in public and private health facilities. Pillar 2. Accelerate efforts towards elimination and attainment of malaria-free status. Countries need to intensify efforts to reduce onward transmission of new infections in defined geographical areas, particularly in settings where transmission is low. In addition to core interventions, attaining this objective will entail targeting both parasites and vectors in well-defined transmission foci, guided by active case detection and case investigations as part of a malaria surveillance and response program. Pillar 3. Transform malaria surveillance into a core intervention. Strengthening malaria surveillance is fundamental to program planning and implementation and is a crucial factor for accelerating progress. There are 2 supporting elements in this strategy: harnessing innovation and expanding research and strengthening the enabling environment. Strong political commitment, robust financing, and increased multi-sectoral collaboration are key factors for further progress. The GTS has proposed concrete milestones and goals to evaluate whether the strategy is successful. These milestones and targets are listed in the table here.
Goals 1 and 2 are related to burden reduction. By 2030, the world has agreed to achieve a 90% decrease in malaria mortality and malaria case incidence compared to the 2015 baseline. Goals 3 and 4, shown inside the rectangle, are specific to elimination and prevention of re-establishment, and hence are relevant to us today. By 2030, the goal is to eliminate malaria, achieve zero indigenous malaria cases in 35 countries where malaria was transmitted in 2015. There were 93 malaria endemic countries in 2015. We met the 2020 milestone of at least 10 countries eliminating malaria. By 2025, we should eliminate malaria in an additional 10 countries and an additional 15 countries by 2030, for a total of 35. Finally, countries that have reached zero indigenous cases must continue working to prevent re-establishment of malaria transmission by sustaining malaria activities as needed to prevent re-establishment. We maintain the gains that have been achieved and avoid a resurgence in transmission that could quickly set back all of the efforts undertaken for decades. Therefore, one of the goals of the GDS is that all countries that reach zero stay at zero. In Unit 9, we will discuss prevention of re-establishment in more detail, along with the steps countries can take to prevent that from happening. It is important to understand how malaria elimination contributes to the achievement of broader development goals. This can be an important advocacy point with governments. The Sustainable Development Goals, SDGs, are a collection of 17 global goals designed to be a blueprint to achieve a better and more sustainable future for all. The SDGs were set in 2015 by the United Nations General Assembly and are intended to be achieved by the year 2030. The Global Technical Strategy for Malaria 2016 to 2030 contributes to SDG 3, Target 3.3, which is to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases by 2030.
In 2022, WHO released new guidelines on interventions in the final phase of elimination and prevention of re-establishment in the WHO guidelines for malaria. Recommendations were developed by an external group of experts who reviewed research evidence for the benefits and harms of different interventions. The quality of the evidence was determined, and the contextual factors such as acceptability, feasibility, health equity, and resources were taken into consideration when making a recommendation. WHO conditionally recommends the use of chemoprevention strategies such as mass drug administration, targeted drug administration, and reactive drug administration depending on the context. However, WHO conditionally recommended against mass and targeted testing and treatment and routine testing and treatment of malaria at border crossings. WHO conditionally recommended reactive interventions under certain circumstances, including reactive drug administration, a form of chemoprevention, reactive case detection, and reactive indoor residual spraying. The WHO guidelines for malaria are updated regularly. Whenever new recommendations are available, there is a link for the guidelines at the end of this presentation. In 2017, WHO released new guidance on malaria elimination in the framework for malaria elimination. The framework addresses all malaria endemic countries, as the GDS urges all malaria endemic countries to work towards the goal of malaria elimination, regardless of where they lie on the spectrum of transmission intensity. Actions to be taken by malaria programs are highlighted along the continuum of malaria transmission, ranging from high levels of transmission to elimination and prevention of re-establishment, with emphasis on planning for successive steps. The framework provides a clear and simplified process for WHO certification of malaria elimination. The guidance on certification is further elaborated in the manual Preparing for Certification of Malaria Elimination. The training materials for this course or workshop have been drawn from the Framework for Malaria Elimination and other relevant WHO guidance, including the Malaria Surveillance, Monitoring and Evaluation, a reference manual published in 2018, and the Malaria Guidelines.
The framework for malaria elimination includes a new concept, the continuum of malaria transmission. Previously, elimination guidance had placed countries into one of three categories: control, pre-elimination, or elimination, based on epidemiological criteria. These categories are no longer used. Instead, it is now recognized that no matter where countries or subnational regions lie on the continuum, they are encouraged to progress towards elimination. The continuum shows that countries and subnational areas can be found all along the range from high transmission, annual parasite incidence of 450 malaria cases per 1,000 population at risk, or a P. falciparum prevalence of greater than 35%, to very low transmission, less than 100 cases per 1,000 population, and a prevalence of P. falciparum or P. vivax less than 1%. The activities and intensity of the program will vary across the continuum, but no matter where a country or subnational region is located along the continuum, there are steps or actions that can be taken to move them down the continuum to a lower level of transmission. In other words, every country and region can accelerate progress towards elimination through evidence-based strategies, regardless of the current intensity of transmission and the malaria burden they may carry. Stratification is the process of classifying geographical areas or localities according to epidemiological, ecological, social, and economic determinants to guide malaria interventions. Accurate stratification of malaria transmission intensity, ideally at the level of localities or health facility catchment areas, is essential for effective targeting of interventions. In Unit 8, we will talk more about stratification and how it helps clarify the strategies to be used to achieve elimination. To achieve elimination, countries are recommended to audit their programs, analyze their situation, and re-stratify annually, adjusting operational plans to anticipate the transition of subnational areas from one stratum to the next as they progress. Through iterative review, analysis, planning, and transition, countries can accelerate towards malaria elimination. This map shows where countries around the world are located on the continuum from high to low transmission. These data are from WHO estimates in the World Malaria Report 2019. Some countries in Central and Western Africa have very high levels of transmission. several countries in Asia have very low levels of transmission. Depending on where countries fall on this continuum, their activities and strategies will differ. But all countries can take steps that will move them closer to elimination. For example, the dark red countries in Africa need to focus on delivering the core malaria interventions, while countries in Central America need to intensively follow up all individual transmission foci and cases. This map shows how subnational areas within countries can be vary substantially, demonstrating a transmission continuum. This example is from the countries in the Greater Mekong subregion, including Cambodia, China Yunnan Province, Lao People's Democratic Republic, Myanmar, Thailand, and Vietnam. You can see that there is a range of transmission in countries such as Myanmar that range from no transmission to annual incidence rates greater than 50 cases per 1,000 population. This variability of transmission intensity, along with other factors affecting malaria transmission, can be exploited through stratification, to be discussed in Unit 10, so the interventions can be tailored to the appropriate transmission level, epidemiology, and ecology of malaria. Some parts of countries that are at a lower level of transmission may be able to move towards elimination at a faster rate, but all regions can take specific actions to accelerate towards elimination. Along the continuum of malaria transmission, the framework provides an illustrative intervention package that can be adapted to different subnational areas in a country. The choice of interventions should be based on transmission intensity, from high to very low to zero and maintaining zero, other epidemiological and entomological characteristics, and also operational capacity and system readiness. This diagram should be seen as illustrative rather than prescriptive, as the start and duration of interventions would depend on local circumstances. The shading in the rectangular boxes showing the different components indicates the enhancements and quality required as programs progress towards elimination. Darker colors indicate more intense actions, and shading from light to dark indicates enhancement of the quality and scale or focus of the work. We will review each component in more details in subsequent units. The take-home messages from this slide are that there needs to be access to the core interventions of vector control and case management everywhere they are needed. Additionally, a sensitive and specific surveillance system is a fundamental component of every malaria program. Areas with low to moderate transmission can consider adding population-wide parasite clearance, i.e., mass drug administration, to rapidly decrease transmission to allow case-based surveillance to begin. When an area's case load is low enough, programs are encouraged to begin case-based surveillance, case investigations, and foci investigations to follow up on every case and prevent onward transmission. The process of stratification captures the variability in malaria transmission across a country and enables interventions to be tailored to the conditions in specific subnational areas. Stratification should be done to the lowest geographical level for which data are available and operational decisions can be made, such as a district, subdistrict, village, or health facility catchment area. At higher levels of transmission, stratification may be possible only at a regional level, but as transmission declines, The units of stratification become smaller to the point that individual foci can be stratified. Once elimination has been achieved, stratification occurs on the basis of malariogenic potential. We will review the process of stratification in detail in Unit 10.
These slides list the key principles of malaria elimination. First and foremost, elimination is a country-owned and country-led process. Only countries can commit themselves to achieving malaria elimination. WHO, other multilateral and bilateral organizations, civil society organizations, and donors can assist with guidance, technical support, and funding. But the decision to eliminate malaria must be taken and supported by the government and population of the country. As a result, elimination can only be achieved where there is significant political will that is translated into sufficient resources to get the job done. But resources are not enough, and strong leaders will be needed to direct effective elimination efforts. Because of the number of government agencies, multilateral and bilateral agencies, and non-governmental organizations engaged in any elimination effort, effective coordination is needed to minimize duplication of efforts and confusion over roles and responsibilities. Elimination is not possible without strong surveillance systems that enable efforts to be directed at areas with ongoing transmission or areas with high malariogenic potential. Additionally, during elimination efforts, surveillance itself becomes an intervention to identify malaria cases early so that appropriate treatment can reduce the risk of onward transmission. Interventions must be intensified and focused on the right areas. Therefore, it is critical to have data available at the most granular level possible to determine where activities should take place and to monitor their impact. One of the key principles of elimination, which has already been highlighted, is the potential for subnational units, regions, provinces, or districts to move at different speeds towards elimination. Exploiting this potential through stratification is one strategy for accelerating towards elimination. Operational research is an essential component. No elimination effort has succeeded entirely based on the interventions available at the start or their methods of deployment. Operational research is needed in order to continuously improve the delivery of interventions to ensure their effectiveness. Once a country has reached at least 3 consecutive years, 36 months, with 0 indigenous cases, it can request certification by WHO. Certification awarded by WHO is the official recognition of a country's malaria-free status and an acknowledgement of the intensive efforts of the government and national malaria control program towards elimination. However, since countries are still at risk of malaria through importation, continued measures to prevent severe disease and re-establishment of transmission will be required until the world is free of malaria. Accelerating towards malaria elimination requires a specific mindset along with some key strategies and approaches. Here are some important lessons learned from successful elimination programs. Stratify countries by subnational areas according to their transmission characteristics, operational considerations, and malariogenic potential enables tailoring of appropriate intervention packages. The process of stratifying interventions according to the local context helps to ensure that the appropriate mix of interventions is in place everywhere to meet the needs of the population and eliminate transmission. To achieve elimination, prevention and case management strategies must account for everyone, even those who may be in the country without legal status. Surveillance systems must work rapidly and efficiently to identify suspected cases, get them tested for malaria, report them to the next level, conduct case investigations quickly to identify the likely location of infection, and respond rapidly to prevent one-world transmission of infections. National malaria programs must involve other sectors and take a whole-of-government approach to malaria elimination to guarantee the program's coverage and sustainability. Finally, national malaria programs seeking to eliminate the disease must have a whatever-it-takes attitude. This is no business-as-usual situation. Elimination requires focus, attention, and energy, and complete commitment from the community up to the highest levels of government. We will pause for a moment to reflect on the topics we have just reviewed. Please break into small groups and consider these 3 questions. I've given you about 10 minutes to discuss, and then we will come back to the plenary to hear your thoughts. What is new to you about the approach to malaria elimination presented in this unit? What specific actions is your country taking to accelerate towards malaria elimination? Is your national program operating under a business-as-usual or whatever-it-takes mindset? In summary, malaria elimination is officially certified by WHO. Measures to prevent re-establishment are required until malaria is eradicated from the globe. By 2030, the goal is for malaria to be eliminated in 35 countries where it existed in 2015. All countries and areas are located at different points along a transmission continuum and can progress towards elimination at their own pace. Elimination is a country-owned and country-led process requiring significant political will. To achieve elimination, effective interventions need to be focused and timely and based on real-time surveillance data.